Welcome. Have you ever heard of a kidney dropping? Today we're diving into nephroptosis, also known as a floating kidney or a wandering kidney. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, sit back, relax, and let's learn about this fascinating, albeit sometimes uncomfortable, condition. What causes a kidney to essentially fall? Nephroptosis primarily occurs when the supportive structures surrounding the kidney weaken. These structures normally hold the kidney securely in place. Factors that can contribute to this weakening include rapid weight loss, which reduces the amount of cushioning fat around the kidney, congenital abnormalities, or even repeated trauma. In some cases, a history of certain connective tissue disorders may also play a role. While anyone can potentially develop nephroptosis, it's more frequently observed in women than in men. Let's get into the nuts and bolts of how nephroptosis affects the body. Normally, the kidneys are anchored firmly in the retroperitoneal space. When a kidney drops, it can kink the ureter, the tube that drains urine from the kidney to the bladder. This kinking can obstruct the flow of urine, leading to a backup and increased pressure within the kidney, known as hydronephrosis. This pressure can cause pain and, if left untreated, can potentially damage the kidney over time. The drop can also cause traction on the renal artery and vein, possibly contributing to pain and, in rare cases, affecting kidney function. The degree of symptoms often correlates with the extent of the kidney's descent. While precise statistics are difficult to obtain, nephroptosis is believed to affect women more often than men, perhaps due to anatomical differences. It's more commonly diagnosed in individuals between the ages of 20 and 40, but can occur at any age. It's important to remember that many people with a degree of kidney mobility may be asymptomatic, meaning they experience no symptoms, and therefore the true prevalence of nephroptosis is likely underestimated. So, how does someone know if they might have nephroptosis? The symptoms can vary greatly. Some individuals experience no symptoms at all. However, when symptoms are present, the most common complaint is flank pain, often described as a dull ache or a sharp stabbing sensation. This pain is typically worsened by prolonged standing, strenuous activity, or dehydration, and is often relieved by lying down. Other possible symptoms include nausea, vomiting, hematuria, which is blood in the urine, and in severe cases, symptoms associated with kidney dysfunction, such as fatigue and swelling. Diagnosing nephroptosis requires a thorough evaluation. The process often starts with a physical exam and a review of the patient's medical history. Imaging tests are crucial for confirming the diagnosis. An intravenous pyelogram, or IVP, is a common choice. This involves injecting a contrast dye into a vein and taking X-rays as the dye passes through the kidneys, ureters, and bladder. This allows the doctor to visualize the position of the kidneys when the patient is lying down and standing up, revealing any significant drop in position. A CT scan or MRI may also be used to provide more detailed images of the kidneys and surrounding structures. Nephroptosis isn't typically classified into distinct types, but rather graded by the extent of kidney descent. The significance lies in the degree of symptoms experienced and the potential for complications, rather than discrete categories. Treatment for nephroptosis depends on the severity of the symptoms. Many individuals with mild, infrequent symptoms require no treatment at all. Conservative management, such as maintaining adequate hydration, avoiding activities that exacerbate the pain, and wearing supportive abdominal garments may be sufficient. For those with more severe, debilitating pain or complications like hydronephrosis, surgical intervention may be considered. The most common surgical procedure is nephropexy, which involves surgically fixing the kidney back into its normal position. Laparoscopic techniques are often used, resulting in smaller incisions and a faster recovery. Unfortunately, there's no guaranteed way to completely prevent nephroptosis. However, maintaining a healthy weight and avoiding drastic weight loss can help preserve the supportive fat around the kidneys. Practicing good posture and avoiding activities that put excessive strain on the abdominal area may also be beneficial. Staying well hydrated can also support overall kidney health. The prognosis for nephroptosis is generally good, especially with appropriate management. Many individuals with mild symptoms can manage their condition effectively with conservative measures. Surgical intervention is typically successful in relieving symptoms and preventing complications for those who require it. While rare, potential complications of untreated nephroptosis can include chronic pain, hydronephrosis, and, in very rare cases, kidney damage. Research continues to explore less invasive methods of nephropexy and a better understanding of the underlying causes of the condition to potentially develop preventive strategies.